Hello and welcome. Today we're tackling semi-solid dosage forms. This is one of those topics that you are guaranteed to see on your pharmacy exams, and we're going to make sure you are more than ready for it. So let's get right into it. All right, let's just dive right in. Ointment, cream, paste. At first glance, they can all seem pretty similar, can't they? Well, trust me, telling them apart is exactly what your exams are going to test you on. So our goal here is to master those key differences. But before we can really get into the nitty-gritty of telling them apart, we need to know what we're even talking about. So let's start with the absolute basics, the foundation. Okay, so what are they? Think of them simply as topical treatments. Things you apply to your skin. They're designed to do one of two things. Either work right where you put them, that's what we call the local effect, or they use your skin as a kind of doorway to get medication into your entire body, and that's a systemic effect. A really good topical treatment is all about this incredible balancing act. It has to feel right on the skin, it has to be safe and not cause irritation, and of course, it has to actually work by releasing the drug effectively. It's this delicate balance between the physical feel, the physiological safety, and the practical application that makes a product great. First up, let's talk about ointments. You can think of these as the heavy lifters, the real workhorses of the topical world. So simply put, an ointment is just a drug that's been mixed into a base. They're amazing for protecting the skin because they're occlusive. That just means they form this barrier that traps moisture in. They're also fantastic emollients, which is really just a fancy way of saying they soften and soothe the skin. Okay, now this is a huge point for your exams, so listen up. Not all ointments are created equal. The biggest difference, the thing you have to know, is all about how deep they penetrate the skin. And this chart here just lays it out perfectly. You've got 3 levels. Epidermic ointments work right on the surface, on the epidermis. Think of a simple antiseptic. Then you have endodermic ones, which go a little deeper into the skin's living tissues. And finally, you have diodermic ointments. These are the ones designed to travel all the way through the skin and into your bloodstream, like a nitroglycerin ointment for heart conditions. Now, that base we mentioned, it's the vehicle that carries the drug, and picking the right one is absolutely everything. Your oleaginous bases, they're basically waterproof and greasy, perfect for protecting a cut. Then you have absorption bases. They're still greasy, but they have the cool ability to absorb some water. Emulsion bases are your water-washable, cream-like options that patients usually prefer. And finally, you've got water-soluble bases, which are totally grease-free and super easy to wash off. As you can see, there's always a clinical trade-off. Next up, let's talk about creams. And you'll see why patients often prefer these. They just feel better on the skin and are way more cosmetically elegant. For creams, the magic word you need to remember is emulsion. It's kind of like a good salad dressing. It's a stable mix of oil and water that don't want to mix. And that's exactly what gives creams their light, soft feel, which is just a world away from a heavy, greasy ointment. Okay, you're definitely going to want to remember this slide because this is a classic exam topic. Creams are either oil and water, or OW, where tiny oil droplets are scattered in water. These are your non-greasy, easy-to-wash-off, vanishing creams. The other type is water and oil, or WO, where it's the opposite. Water droplets are suspended in oil. These are greasier, more occlusive, and you might know them as cold creams. All right, let's round this out with 2 more specialized forms you've got to know: pastes and jellies. So what makes a paste a paste? Well, it's all about the powder. I mean, we're talking a huge amount of solid particles in there, often more than 50%. That massive amount of powder is what makes them so thick, so stiff, and so incredibly protective. A great example is zinc oxide paste. And jellies, well, jellies are pretty much the complete opposite. They're typically clear, totally non-greasy, and water-based. Instead of a bunch of powder, they use gelling agents, like natural gums or synthetic polymers, to get that jelly-like consistency. Think of things like lubricating jellies or that aloe vera jelly you use for sunburn. Okay, deep breath. Let's boil all of this down. Here's what you absolutely positively need to have locked in for your exams. Seriously, if you only walk away with one thing, let it be this slide right here. Ointments, they're greasy and protective. Creams, they're elegant emulsions. Pastes, they're super stiff with tons of powder, and jellies, clear, non-greasy, and water-based. If you can master these one-liners, you're in great shape. And to finish up, here's a little thought experiment for you. Let's apply this. Imagine you need to deliver a drug that dissolves in water. and your patient is insisting on something that doesn't feel greasy. Which one of those ointment bases we talked about would be the perfect choice? Thinking through these kinds of clinical scenarios is exactly how you're going to nail this topic on your exams.